Hello, everyone, and welcome to Schein Chats. My name is Erica Smith, and I'm the Surgical Solutions Market Developer here at Henry Schein, where my department focuses on supporting ambulatory surgery centers. And I'm here today with Caitlin Stowe, who is the Clinical Affairs and Medical Liaison for ActivePure Medical, where they focus on full facility, continuous and automated surface and air disinfection. Caitlin, how are you doing today?
I'm good, Erica. Thank you for having me.
Thank you for coming. Really appreciate it. And, today we are here to talk infection prevention in ASCs, which is a very, 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 very important topic. It's fun for you and I because we love germs. It may not be fun for other people, but it is something that we need to talk about. And we know how important it is to create, implement, and follow through with infection prevention procedures. So that way it can try to eliminate SSIs or surgical site infections or healthcare associated infections. In your opinion, what gaps have you seen either from the pandemic or just everyday wear and tear, I guess you want to say? What gaps have you seen when it comes to infection prevention, clean, and disinfection?
So that's a really good question. I've been an infection preventionist for about almost 15 years at this point. So I've seen quite a bit. I started my career with the H1N1 pandemic. So that was really fun, kind of a baptism by fire. But honestly, a lot of the challenges that we see in ambulatory surgery centers, we see in acute care. So, lack of hand hygiene, people not doing hand hygiene when they need to, inappropriate surface or inadequate surface disinfection, not cleaning surfaces when they need to, as frequently as they need to, with the right chemicals. We've also seen inadequate PPE supplies, especially with the pandemic. The supply chain shortages have really exacerbated that. But also there's a really big focus now on a couple of areas in infection prevention that we really haven't targeted before that were really highlighted in the pandemic. So the first one would be floors as a reservoir for pathogens. Curtis Donsky's lab out of the Cleveland VA has done a lot of really good research around how floors can be reservoirs for potential pathogens, but also air quality is a really big one that we really haven't focused on before. Historically in infection prevention, if a disease was transmittable through the air, that was really the only time we worried about air quality. And so really taking a look at, especially with the pandemic, exacerbating how pathogens can be transmitted through the air and on surfaces has really, really been, I think, a new and big focus for us.
Yeah, I can definitely see that. It was one of the things when the pandemic hit, on both medical and dental side, we're like, wait a minute, the air, the floor, the walls, this and that. And then going back to hand hygiene being one of the gaps, they got to focus on these things. So like, the PPE, personal protective equipment that you said, surface disinfection, now adding in the air quality, air disinfection, and there's many other infection prevention things that we can go down the list. But how important is it addressing each of those aspects, but, encompassing it all together in order to keep an ASC safe and clean?
So that's a really good question. So when you think about all of those things, they all kind of work hand in hand in the chain of infection. So, you have to have a host, a reservoir, a mode of transmission, and a pathogen, and all of those have to be in place to have a transmission infected, right? So my job as an infection preventionist or a healthcare worker's job in doing their role is to kind of help break that chain of infection, right? So hand hygiene, for instance, right? We know when it needs to be done. We have the WHO, the World Health Organization's 5 moments for hand hygiene. A lot of people are familiar with that, but there's a really good collection of research that shows that healthcare workers only perform hand hygiene about 40% of the time. But in their day-to-day activities, they get really busy. And sometimes that really important, but very simple task kind of falls to the wayside, right? So if you add in healthcare workers having dirty hands, and then if we have inadequate surface disinfection, so they're not using the right disinfectant, or they're not keeping the right contact time, or they're just not wiping down as often as they need to, we can have kind of back and forth transmission between hands becoming contaminated from the dirty surfaces, or the dirty hands contaminating the clean surfaces. So those two things are super important, right? And then you think about PPE, wearing gloves when you should, all of that just kind of plays into the continuing chain of infection transmission that we see. And really, that's our main focus as infection prevention, is to help break that. Air quality too is super important because those pathogens can get aerosolized. And then they'll get spread around on, on surfaces, they'll land on surfaces, and they can live for anywhere from a few hours to a few months, which is so crazy to think about. But again, that's just another risk of contamination that we bring into. So we really have to have really good hand hygiene, really good surface disinfection, and really be thinking about those alternative contamination reservoirs that could potentially harbor pathogens that we can then spread to our patients and other staff members that cause infections.
Right, right. And I mean, not to harp on hand hygiene, but it is so important. In those same studies that you're talking about, they mentioned that the number one way to try to prevent spread of transmission is washing your hands. And some of those studies, when they're asking these healthcare workers, like, why aren't you doing it correctly, or whatever, there was two main things that stood out to me. One is not enough resources, so maybe not enough sinks or hand sanitation devices in their area. But the other big thing was not enough staff, not enough people, which creates not enough time. And the pandemic has increased that even more. So we have less people working, but more things to care for because of what was created throughout the pandemic. So if a surgery center, an ASC, is, going through these staffing shortages, is there ways that they can become efficient with still preventing healthcare associated infections, and efficient in their infection prevention procedures with having, a shortage of staff members?
Yeah, shorting staffages are something that every healthcare setting is facing, whether it's acute care or long-term care or even ambulatory surgery. So it's hard to really keep infection prevention at the focus when you're worried about staffing appropriately, right? So as an infection preventionist, things that I would be concerned with are implementing technologies or practices that are going to help my staff without taking additional time. So some of that might be automated hand hygiene systems and monitoring systems, right? So making sure that I have hand hygiene supplies adequately at point of care, because there's really good evidence showing that if we have supplies at where the provider is performing care, they're more likely to use them, which is common sense, right? But we just don't do that.
Right.
Another thing is, what kind of technologies can we bring in that can do some of the work or act as an adjuvant for some of the work that they're doing? So for instance, there are some surface disinfectants now that are continuous, meaning that they have persistent activity on the surface. So maybe if I use some of those disinfectants and I forget to wipe down a surface, I'm still protected because this disinfectant is continuing to have that persistent activity. Another thing is, especially when it comes to air, is there are great systems out there that not only purify the air, but also can actually kill the pathogens in the air and on the surface as well, adding an extra layer of protection to kind of step into the gaps where staff, because they're strapped for time and there's just not enough of them, may sometimes miss because they're just overwhelmed.
Right. So you answered my next question, which was, how does technology play into this? So that is excellent. So my last question for you is, what do you see the future looking like for infection prevention in ASCs?
So I think the pandemic has actually really been a blessing in disguise for infection prevention, because I think it has brought a lot of needed attention to the historically underfunded and undervalued infection preventionists. And I say that with a great amount of bias because I am one, but I think we're going to see a lot more technology come into the space for infection prevention, again, with a lot of automation, maybe surveillance activities, allowing IPs to spend more time doing that face-to-face education, a lot more automated technologies for hand hygiene, whether it be badges that remind you to do hand hygiene or will automatically dispense when you walk into a room, different technologies when it comes to like UV robots, also again, continuous surface and air disinfection. There's just so many things that I think can help from a technology standpoint, us do our jobs more efficiently and help address some of those staffing challenges that we worry about.
Well, perfect. Thank you so much for your time today. And it is always a pleasure to see what you and the ActivePure team are doing for the medical and dental community. And it is such an honor that you team up with us here at Henry Schein so we can help you with that resource. So, and thank you everyone for listening in on infection prevention and germs. Again, my name is Erica Smith, and we'll see you next time on Schein Chats.